Hello friends, welcome back to World of Pharmacology. Today we are going to discuss the topic Pharmacokinetics, Absorption and Distribution. So what is pharmacokinetics? Pharmacokinetics is a study of drug movement in, through and out of the body, or it is a study on what the body does to the drug. Whenever we hear the term pharmacokinetics, connect it with ADME because it deals with the study of absorption, distribution, metabolism, and excretion of the drug. What is absorption? Absorption is the movement of drug from the site of administration to systemic circulation or blood. Drug is transported across the membrane by one of the below mentioned processes. First one is passive diffusion and filtration. Second one is specialized transport, which include facilitated diffusion and active transport. Finally, endocytosis. Passive diffusion. Most drugs are absorbed by passive diffusion and no energy is needed in this kind of transport. Here, drug moves in the direction of its concentration gradient, that is, it moves from a region of high concentration to a region of lower concentration. Lipid-soluble drugs move by passive diffusion. The figure shows the movement of drug from a region of high concentration to lower concentration through the membrane. Next is filtration. In filtration, drug passes through pores or paracellular spaces in the membrane. In the figure, that white part shows the paracellular or pores in the membrane. Water-soluble drugs use this method if their size is smaller than the diameter of the pores. Facilitated diffusion. Here, carrier proteins transport the drug from a region of high concentration to a region of lower concentration. The figure shows the binding of drug with the carrier protein. They form a complex and passes through the membrane and releases the drug into the region of lower concentration. Next one is active transport. Active transport involves the use of energy which is obtained by the hydrolysis of ATP to ADP. This energy is due to the breaking of the phosphate bond, and thus, due to this energy, movement of drug from a region of lower concentration to high concentration takes place. Last one is endocytosis. In endocytosis, drugs of larger size get absorbed by the process called the engulfment. Now let us look into the factors that influence absorption. First one is pH. Drugs are absorbed in their unionized or united form. So drugs that are acidic in nature are unionized in the gastric pH, and so they are absorbed from stomach, whereas basic drugs are absorbed from the intestine as they are unionized in the intestinal pH. Area of absorbing surface. Stomach has lesser surface area compared to that of intestine. So absorption will be more from intestine than that of the stomach. That is, larger the surface area, greater will be the absorption. Presence of other substance can either increase or decrease absorption. Milk and tetracycline is an example for decrease in absorption, as tetracycline can form poorly absorbable drug complex with the calcium in milk. And all these factors have given way to the concept of bioavailability. Bioavailability refers to the rate and extent at which a drug is absorbed by the systemic circulation, or in other terms, it is a measure of the fraction of administered dose of drug that reaches the systemic circulation in the unchanged form. Except for IV route, drug given through other route need to be absorbed first, and majority of it gets eliminated before it reaches systemic circulation. So now let us see the graph. Time is plotted on the x-axis and plasma concentration of drug is plotted on the y-axis. A drug given IV starts at a concentration of 100% as it is directly injected into the systemic circulation, and it declines over a period of time. On the other hand, oral route of drug administration reaches its maximum level at some point of time and declines with the passage of time. An area under curve for both routes of drug administration is measured. So bioavailability can be represented by the equation F equal area under curve for oral route of administration by area under curve for IV route times 100. So this helps us to know what fraction or amount of drug is responsible for the therapeutic effect in a person. After absorption, drug gets distributed inside the cell as well as outside the cell. So distribution of drug depends on factors like lipophilicity. Higher lipophilic drugs have greater distribution. Lipophilic drugs have greater distribution compared to that of hydrophilic drugs. Next one is blood flow. Drug distribution will be greater in organs with high blood flow. So distribution will be greater in brain and lesser in skin. But please note that only drugs that can cross the blood-brain barrier can reach the brain. Next is capillary permeability. Capillaries of liver have large intercellular pores, so drugs get distributed in liver faster compared to brain that has tight junction that does not allow the passage of lipid-insoluble drugs. Plasma and tissue binding. Most drugs possess an affinity for plasma proteins, and majority of the drug binds to the plasma protein albumin, and this binding decreases the distribution. Final and most important one is volume of distribution. Let us see volume of distribution in detail in the next slide. Volume of distribution. It is apparent volume in which drug is dissolved after reaching equilibrium. It can be represented as V is equal to dose administered IV by plasma concentration. For example, 1000 mg of drug reaches the blood, and after attaining equilibrium, we measure its plasma concentration, which is 50 mg per deciliter. So V equals 1000 by 50, which is equal to 20 liter. So if a drug has large volume of distribution, we have to administer large dose of drug to attain high concentration and vice versa.